Welcome. This is an overview of the cardiac system. It was created for nursing students. You can use this to prepare for class or for test prep. This presentation covers the function and structure of the heart, what the heart needs to work well, some common cardiac diseases, a basic cardiac assessment, some nursing interventions in cardiac care, and basic cardiac pharmacology. What does the heart do? The heart is a muscular pump that drives blood throughout the body. Its main function is to deliver oxygen and nutrients to the tissues. It also removes carbon dioxide and waste products. The heart also transports things like hormones, such as insulin, thyroid hormones, epinephrine. It also carries immune cells and proteins, as well as clotting factors. The heart transports blood throughout the body through its pumping action. It relaxes and contracts in an organized fashion. When it contracts, that period of contraction is called systole. When it relaxes, the period of relaxation is called diastole. During diastole, the heart fills with blood. And during systole, the heart forcefully contracts to eject that blood out of the ventricles and where they need to go. The heart circulates blood in two ways, through the pulmonary circulation and the systemic circulation. In the pulmonary circulation, the right side of the heart receives blood from the body, deoxygenated blood. This blood is then transported to the lungs where it gets oxygenated. From the lungs, the oxygenated blood is transferred to the left side of the heart, and this is where the systemic circulation starts. The oxygenated blood in the left side of the heart is then ejected from the left side of the heart to the rest of the body, and that is the systemic circulation. Heart structure. In terms of heart structure, this presentation will cover the heart chambers, its valves, blood flow and blood vessels, and the heart's walls/muscles. The heart has four chambers: the right atrium, the right ventricle, the left atrium, and the left ventricle. Both sides of the heart, the left and right side, are separated from each other by the septum. The right atrium receives deoxygenated blood from the body through the vena cava. It then sends this blood to the right ventricle. The right ventricle pumps blood to the lungs through the pulmonary artery. The left atrium receives oxygenated blood from the lungs. This blood goes from the left atrium to the left ventricle. The left ventricle pumps oxygenated blood through the aorta to the body. And again, the septum separates both the left side and the right side from each other. The heart has four valves: the tricuspid valve, the pulmonic valve, the aortic valve, and the mitral valve. The tricuspid valve and mitral valves are both atrioventricular valves, meaning they are found between an atria and a ventricle. The tricuspid valve is found between the right atrium and the right ventricle, while the mitral valve is found between the left atrium and the left ventricle. The pulmonic and aortic valves are both semilunar valves. The pulmonic valve is found between the right ventricle and the pulmonary artery, while the aortic valve is found between the left ventricle and the aorta. The function of the valves is to make sure that blood flows through the heart in one direction only, in a forward direction. So if a valve is healthy, the blood will flow through it in one direction only and not back and forth. When you have blood flowing through a valve in a forward and backward motion, that valve is not healthy. Blood flow through the heart/blood vessels of the heart. Blood gets delivered to the heart for two reasons. Blood gets delivered to the heart for oxygenation, and blood gets delivered to the heart for its own nourishment. The vessels that deliver blood to the heart for its own nourishment are the coronary arteries, and the vessels that send blood to the heart to be oxygenated from the body are the superior and inferior vena cava. We will be talking about how the blood receives the oxygenated blood for oxygenation. Now, deoxygenated blood gets delivered to the right atrium through the inferior and superior vena cava. The deoxygenated blood in the right atrium then goes from the right atrium through the tricuspid valve and into the right ventricle. From the right ventricle, the oxygenated blood is then transferred to the lungs where they get oxygenated through the pulmonary artery. The pulmonary artery is the only artery that carries deoxygenated blood. Arteries usually carry oxygenated blood. Why? All arteries carry blood away from the heart. The blood could be oxygenated or deoxygenated. In this case, the only artery that carries deoxygenated blood is the pulmonary artery. All other arteries carry oxygenated blood away from the heart. Once the blood gets oxygenated in the lungs, it gets transferred to the left atrium through the pulmonary vein. Like the pulmonary artery, the pulmonary vein is the only vein that carries oxygenated blood. It is different from the other veins in that the other veins carry usually deoxygenated blood, while the pulmonary vein carries oxygenated blood. Why? All veins carry blood to the heart. The pulmonary vein carries blood to the heart except the blood is oxygenated. Once oxygenated blood gets to the left atrium, it is transferred from the left atrium to the left ventricle through the mitral valve. From the left ventricle, the blood is then transferred, ejected to the rest of the body through the aorta. This is how blood gets distributed throughout the body. This is how blood flows through the heart, and these are the vessels that assist in the transfer of blood to the heart, through the heart, and out of the heart. We're talking about the superior and inferior vena cava, the pulmonary artery, the pulmonary vein, and of course the aorta. Cardiac wall slash muscle. The heart wall has three layers: the endocardium, the myocardium, and the epicardium. And all of these layers are enclosed in a double layered sac called the pericardium. The pericardium holds a small amount of lubricating fluid called the pericardial fluid. It helps to reduce friction when the heart moves, because when the heart relaxes and contracts, it is moving. The endocardium is the smooth innermost lining of the heart. This is the layer of the heart that is in contact with the blood that comes into the heart and leaves the heart. The myocardium is the muscular middle layer that actually does the contraction movement of the heart. It is the biggest layer in the heart wall and is the muscular layer of the heart wall. The epicardium is a protective outer layer of the heart. Like we said, all of these layers are enclosed in a double layered sac called the pericardium, and this pericardium has a little bit of lubricating fluid in it called the pericardial fluid. Now, this fluid needs to stay in a small amount to prevent um, injury to the heart or to prevent heart disease. If the fluid is too much, a situation called cardiac tamponade occurs. And in cardiac tamponade, there's too much fluid in the pericardial sac. And this fluid can start compressing the heart to the point where the heart is unable to relax to adequately fill with blood and unable to contract forcefully enough to deliver enough blood to the rest of the body. So, cardiac tamponade could become a medical emergency due to reduced cardiac output, the amount or the volume of blood the heart is ejecting per minute. Cardiac requirements. What does the heart need to work properly? For optimal function, the heart needs adequate oxygen supply to itself through its coronary arteries. Every cell in the body needs oxygen to stay alive and to keep working. If a cell is deprived of oxygen, that cell will die and will be unable to do what it's supposed to do. So the heart needs adequate oxygen supply to work properly. Balanced electrolytes are also needed for good cardiac function, especially sodium, potassium, and calcium. These three electrolytes assist in muscle contraction. A normal conduction pathway is necessary for the heart to work properly. So, the organized beating of the heart is stimulated by the heart's electrical conduction system. So, the electrical conduction system of the heart consists of the SA node, the AV node, the bundle of His, the left and right bundles, and the Purkinje fibers. The SA node, which is the sinoatrial node, is the pacemaker of the heart. So, this SA node dictates the rate at which the heart beats. The SA node usually will stimulate the heart to beat from 60 to 100 beats per minute. This will fall in within the normal range of heartbeat of a healthy human heart is 60 to 100. Now, once the SA node fires, once it releases an electrical impulse, it stimulates the atria to contract. This electrical impulse is then transferred to the AV node. The electrical impulse travels from the AV node to the bundle of His. But before this happens, there's a slight delay of the electrical impulse at the AV node. This happens so that the ventricles will will have some time to fill up with blood before it contracts, so that when it contracts, it has adequate amount of blood to pump out to the body or pump out to the lungs for oxygenation. The electrical impulse travels from the bundle of His to the left and right bundle branches. So these branches extend from the bundle of His to the left ventricle and then to the right ventricle. From the left and right bundles, the electrical impulse goes to the Purkinje fibers. The Purkinje fibers are a network of fine nerve fibers that spread throughout the ventricular walls, and they distribute the electrical impulses to the heart muscle cells. So once the electrical impulse hits the Purkinje fibers, the ventricles will then contract. So it's important for the heart's electrical conduction system to work properly because they maintain the regular heartbeat of the heart. They also maintain the rate at which the heart beats. So if anything goes wrong with the electrical conduction system, the heart may start beating at a rate that is not conducive with life. It may also start beating irregularly in a disorganized manner, which may impede or obstruct the efficient delivery of blood out of the heart to the rest of the body. Um, the heart also requires stable preload, afterload, and contractility to maintain cardiac function. What is preload? Preload is the pressure in the ventricles when they are filling with blood. So basically, the pressure is adequate if there's enough preload, sorry, is adequate if there's adequate amounts of blood in the ventricles. If preload is low, then it means there's low amounts of blood in the ventricles. If preload is too high, the heart is probably overloaded with blood. So the heart requires a stable preload, a stable amount of blood in the ventricles to be able to work properly. Afterload is the pressure that the left ventricle has to push against, has to eject against in order to pump blood out of itself into the aorta and to the rest of the body. If the pressure is too high, the heart has to work extra hard to eject blood. And at some point, it might get tired. And we have a situation called heart failure. So, afterload needs to be at a stable level so that the heart can work properly. The heart also needs to be able to contract properly to eject blood out of itself. Basically, the ventricles need to be able to contract properly to eject blood out of themselves. For this to happen, the heart needs healthy muscles. If there's any kind of disease affecting the heart muscles, it might not be able to contract adequately enough to pump out blood to the rest of the body or to the lungs, even. Next, the heart also needs enough circulating volume so that it can effectively transport blood to all of the tissues in the body. What does this mean? It means there has to be enough fluid in the body, enough blood in the body for the heart to transport. So, if, for example, a patient is bleeding out, that patient is not going to have enough blood for the heart to pump out to the rest of the body. So, the amount of volume in the body also affects how well the heart performs in its job of transporting blood to all parts of the body. A healthy vascular system is also necessary so that the heart can work well. A healthy vascular system carries blood. If it is obstructed, it's unable to carry blood in whichever part is obstructed. So, if a vessel leading to a certain part of the heart has an obstruction in it, the part that it nourishes will start to die because there is a lack of oxygen. So, the vessels need to be patent so that the heart can do what it's supposed to do. Now, if the vessels are narrowed, it's also going to affect how well the heart pumps blood to all the tissues of the body. So if the heart is doing its job, it's contracting, it's relaxing, it's pumping out the blood, and it's pumping blood into a vessel somewhere that is narrow, whatever part of the body that vessel supplies will not receive enough oxygen, and that part of the body may start to get ischemic in a situation where there's reduced blood flow and reduced oxygen delivery to that part of the body. So, for the heart to work well, it needs adequate oxygen supply to itself. It needs balanced electrolytes. It needs a normal conduction pathway that involves the SA node, which stimulates the heart to beat at a rate of 60 to 100 beats per minute and is located in the right atrium. The next is the AV node, which stimulates the heart to beat at the rate of 40 to 60 beats per minute. If the SA node ever stops functioning, the AV node can pick up and become the heart pacemaker, but it can only stimulate the heart to beat at a rate of 40 to 60 beats per minute normally. The bundle of His is the next stop on the conduction pathway of the heart. The bundle of His stimulates the heart to beat at a rate of 20 to 40 beats per minute. From the bundle of His, the electrical impulses are transferred to the left and right bundle branches and then to the Purkinje fibers. The heart also needs a good amount of preload, afterload, and contractility to work well as sufficient circulating volume and a healthy vascular system for oxygen delivery and return. Pathophysiology of the heart. Some basic diseases of the heart are as follows: coronary artery disease. Here, there's a narrowing of the coronary arteries due to plaque. This causes decreased oxygen supply to the heart muscle, and it can lead to something called angina. Angina pectoris is chest pain that occurs due to reduced blood flow to the heart, and it can be relieved by rest or a medication called nitroglycerin. Myocardial infarction is a complete blockage of one of the coronary arteries or more of the coronary arteries. It leads to tissue death and permanent loss of function in the affected area because that area that is affected is not getting any oxygen at all. And if there is a lack of oxygen, cells start to die. Heart failure. Heart failure occurs when the pumping ability of the heart is weakened. So the heart is unable to effectively pump out enough blood to the rest of the body for perfusion and oxygen delivery. In this case, there could be fluid backup, but where the fluid backs up to depends on which part of the heart is failing, the right side or the left heart side. If the right side of the heart is failing, if we have right-sided heart failure, fluid backs up from the right ventricle to the right atrium and then to the rest of the body. So a patient with right-sided heart failure may present with swelling in their legs or with ascites, accumulation of fluid in the abdomen. In the case of left sided heart failure, blood backs up from the left ventricle to the left atrium and then back into the lungs. So, a patient presenting with left sided heart failure will have fluid in their lungs. So, when you listen with your stethoscope, you will hear or you could hear crackles. This patient may also have difficulty breathing. The patient may not be able to sleep laying flat. The patient may require multiple pillows at home to sleep sitting up, or when they're in the hospital, you have to raise the head of the bed up so that they can comfortably sleep and breathe well during the nighttime. Arrhythmias. Arrhythmias occur due to abnormal electrical rhythm in the heart. So, when there's abnormal electrical impulses in the heart does not beat in an organized way. It may beat too fast, it may beat too low, beat too slowly, or the rhythm of the heart itself will be disorganized, such as in the case of atrial fibrillation, where the atria are quivering instead of contracting. The ventricles could also fibrillate in the case of ventricular fibrillation, where the ventricles are quivering instead of contracting. When the ventricles go into ventricular fibrillation, it's a medical emergency because it could lead to cardiac arrest. So these are some arrhythmias that could occur due to abnormal electrical rhythm in the heart. Valvular disease affects the heart valves. The valves could be stenosed or they could be regurgitant. When they are stenosed, it means they are hard to open, so it will be difficult for blood to flow through stenosed valves. When the valves are regurgitant, instead of the blood flowing in one direction, such as from the right atrium to the right ventricle, it flows back and forth. It flows into the right ventricles, and when the right ventricles contract, the blood will flow into the pulmonary artery and back into the right atrium. So a regurgitant valve will allow blood to flow back and forth through it instead of just in one direction only. This can lead to impaired blood flow and volume overload. Cardiac tamponade is fluid accumulation in the pericardial sac that compresses the heart. It can restrict filling of the heart and can lead to low output of blood from the heart. Cardiac infections and inflammation. Some examples are pericarditis that affects the pericardium. It could be inflammation of the pericardium, infection of the pericardium. It could be myocarditis, which affects the muscles of the heart, or endocarditis, where the innermost lining or layer of the heart is affected by infection or inflammation. Hypertension is also an example of heart disease. In hypertension, there's chronic elevated arterial blood pressure. This increases afterload and forces the heart to work harder. It can lead to left ventricular hypertrophy, where the left ventricle is working so hard that the muscles get bigger than what they are usually. This can also lead to heart failure because the heart can't keep working so hard indefinitely. It will get tired, the muscles will get weaker. It is also a risk for coronary artery disease. Some other diseases that affect the heart could be congenital in nature, where a person is born with a condition such as tetralogy of Fallot, and heart disease could occur due to trauma or rupture, as well as due to cancer. Basic cardiac assessment. When cardiac structure or function is disrupted, it can lead to disease. When you look at a patient to conduct an assessment, these are some of the things you look at: color of the patient's skin and mucous membranes. They could be pale, they could be cyanotic, they could be flushed. Lung sounds, such as crackles and wheezes, can be auscultated with a stethoscope. Edema or swelling in the legs or sacrum or abdomen can be visualized with the eyes. A capillary refill can be done that should show um, a refill of a refill time of less than 2 to 3 seconds. Um, the jugular vein can be visualized. It could be distended or it could be normal. Heart sounds can be auscultated. The normal heart sounds are S1 and S2 For the most part, any other sound apart from S1 and S2 that indicates disease could be murmurs or extra beats such as an S3 and an S4. A pulse is also part of a basic cardiac assessment, feeling for a pulse, palpating a pulse. Pulse could be felt to be irregular, too fast, or too slow, or it could be weak, thready, or it could be normal or bounding. Urine output could also be a part of a basic cardiac assessment. Why? The heart perfuses the kidneys with blood. And as long as the kidneys are getting perfused with blood adequately, it should put out adequate amount of urine. If the kidney sense that it's not getting perfused well enough, or if it's not getting perfused well enough, the patient may not make adequate amounts of urine. But then the kidneys also act to stimulate the heart to deliver more blood to it. And if the heart is already having a difficult time delivering blood to the kidneys, when the kidneys act to make it work harder to deliver more blood to it, this can lead to more problems for the heart or more work for the heart. Vital signs. Vital signs is a part of any basic nursing assessment. So, vital signs would include blood pressure. Is the patient hypertensive, normotensive, or hypotensive? A heart rate, is the patient tachycardic, bradycardic, or is the heart rate normal? Oxygen saturation, is the patient's oxygen saturation normal? Is it over 92%? Check respiratory rate. Is the patient tachypneic, breathing too fast? Is the patient breathing too slow? Or is the patient breathing normally? Pain is also a vital sign. For the patient going through angina, they may complain of chest pain. So pain is part of vital signs that's collected during any kind of cardiac assessment, but definitely included in the basic cardiac assessment. Temperature is also a vital sign that needs to be checked. Negative findings. Some negative findings during a basic cardiac assessment are pale or cyanotic skin. This may indicate anemia in the case where a patient is pale, or poor oxygen delivery where the patient is cyanotic. When a patient is cyanotic, they look blue in certain areas of the body, maybe their face or the tips of their fingers. Um, crackles. Crackles in the lungs may signal fluid overload from left sided heart failure. Jugular vein distension may indicate right sided heart failure or volume overload. Edema may indicate right sided heart failure. Edema may be noted in the patient's lower extremities, their legs. It may be seen as accumulation of fluid in their stomach or abdomen as ascites. Tachycardia. The patient's heart may be beating too fast, and this is a compensatory mechanism for low output. It could also be an indication of other things such as a fever. Bradycardia is another negative finding where the patient's heart is beating too slow. It may be due to conduction problems, or it may be due to medication that the patient took. If the patient is hypotensive, they may be in some sort of cardiogenic shock or failure of the heart to pump as usual, or some kind of shock. If the patient is confused, delirious, agitated, unresponsive, it may be due to the fact that there's decreased perfusion to the brain. The heart is not pumping out enough blood to be delivered to the brain. If the patient's extremities are cold, the patient may be going through peripheral vasoconstriction, where the vessels leading to the peripherals of the body are constricted, such as to the feet and to the hands. Also, if you are able to palpate a pulse to any part of the body, feel the temperature of that area. If it is cool to the touch, it may be an indication that that area of the body is not getting perfused properly. Or if there's no pulse at all, it may be that there is no perfusion at all to that area. And the appropriate provider needs to be notified so that something can be done about it. Chest pain could indicate angina or a myocardial infarction in a patient that's going through decreased blood supply to the heart or total lack of blood supply to a certain part of the heart. Some basic cardiac diagnostics. Some basic tests that are done if a patient is suspected to have some kind of heart disease or heart problems are one, an EKG. It measures the electrical activity and rhythm of the heart. An echocardiogram is basically an ultrasound of the heart. It looks at blood flow, heart movement, and structure. Blood work. Blood work can be done to test for heart disease, such as to see if a patient is going through a myocardial infarction. In this case, you want to test for cardiac enzymes such as troponin and CKMB. A chest x ray is also part of the diagnostics for heart disease. It assesses heart size and looks at pulmonary congestion, such as in left sided heart failure. Cardiac cath or cardiac catheterization. This is when um, a provider is able to visualize the coronary arteries to see if they're patent and open or if there are any blockages that need to be taken care of. Basic nursing interventions for cardiac patients. For the patients with heart failure, monitor vital signs and check daily weights to see if the patient is retaining fluids. Assess lungs for crackles for the patients with left sided heart failure. Give diuretics, ACE inhibitors, or beta blockers as ordered. These are all medications used to manage cardiac disease such as heart failure or high blood pressure. Restrict sodium and fluid intake. Patients that are told to reduce the amount of sodium that they're taking or reduce their fluid intake are being told to do this so that they can reduce the amount of fluid they're retaining. Having a high sodium content in the body means that the patient may retain fluid, and if the patient is on a fluid restricted diet, then the goal is for them to only consume a certain amount of fluid a day to most likely avoid being fluid overloaded. Elevate the head of the bed to ease breathing for the patients with left sided heart failure who have fluid backed up in their lungs. Sleeping on their backs will be problematic and uncomfortable, so most likely they will be sleeping sitting up in the bed or sleeping propped up with pillows. And if they're in the hospital or have a hospital bed, one thing that can be done to help them breathe easier is to sit them up in the bed or elevate the head of the bed. Educate the patient about a low salt diet, medication adherence, and early symptom reporting. We talked about sodium retaining, causing retention of fluid earlier. So, teaching the patients about consuming a low salt diet is important. Medication adherence, them taking their medication as and when ordered, is important. And teaching them what symptoms to report early is important, such as a weight gain of a certain amount. They need to report that to their primary care physicians so that they can do something to help them lose that weight or make sure that they don't gain any more weight. For patients with arrhythmias, which is disorganized cardiac rhythms, monitor vital signs, cardiac rhythm, and perfusion. Administer antiarrhythmic medications as ordered, and prepare for cardioversion of or defibrillation if indicated. Patients with arrhythmias may also need pacing. Patients that have had a myocardial infarction provide oxygen as needed, administer aspirin, nitroglycerin, and morphine as ordered, monitor vital signs, EKG, and troponin levels, encourage rest and stress reduction, teach the patient about smoking cessation, which is stop smoking, diet, and exercise. Some general cardiac health interventions that can be taught to patients are encourage smoking cessation, promote a heart healthy diet, which is a low fat, low sodium diet, encourage regular exercise and stress management, teach the patient how to regularly check their blood pressure, and follow up with their primary care doctors for cholesterol and glucose monitoring. One important thing for the patients taking blood pressure medications or even diuretics is that they should get up slowly because they're taking medications that could make them hypotensive if they get up suddenly. And if they get hypotensive, they may get dizzy and they may fall. Basic nursing interventions in heart disease. Monitor vital signs. That's blood pressure, heart rate, respiratory rate, temperature, oxygen saturation, and pain. This helps detect changes in cardiac output, oxygenation, and perfusion early. Assess the patient's apical pulse for rate, rhythm, and quality. Irregularities may mean arrhythmias or worsening in the patient's cardiac function. Monitor for changes in heart sounds. That is, if there are extra heart sounds, such as an extra S3 and S4 sound, or if there are murmurs. Abnormal sounds can indicate fluid overload, valve disease, or heart failure. If indicated, start continuous EKG monitoring. This helps detect arrhythmias or ischemic changes quickly. Assess the patient for chest pain. Find out information about the location, duration, intensity, and precipitating factors concerning the chest pain. This helps differentiate between stable angina, unstable angina, or a myocardial infarction. In stable angina, the chest pain is relieved with rest or medication like nitroglycerin. In unstable angina, this chest pain occurs at rest and with very minimal exertion, and it's considered a medical emergency. In a myocardial infarction, rest does not relieve the pain, and a myocardial infarction is a medical emergency. Monitor the patient's intake and output. This could help detect fluid overload or dehydration in the patient. Weigh the patient daily at the same time and on the same scale. The patient's weight over time could be an early indicator of fluid retention or worsening heart failure. Assess for peripheral edema, ascites, or jugular venous distension, JVD. This could provide signs of fluid overload and right-sided heart failure if they are present. Restrict fluids and sodium as prescribed. This helps reduce fluid retention and cardiac workload. Elevate the patient's extremities if edema is present. This helps promote venous return and reduces swelling in the patient's extremities. Administer diuretics as ordered. An example is furosemide. This promotes fluid excretion to reduce preload and pulmonary congestion, fluid in the lungs. Administer medications as prescribed and monitor the effects. For example, administer beta blockers, ACE inhibitors, ARBs, diuretics, nitrates, statins, and anticoagulants as prescribed. These medications help improve cardiac output, control blood pressure, decrease myocardial workload, and prevent complications from heart disease. Check the patient's blood pressure and pulse before giving cardiac drugs, especially beta blockers and digoxin. This helps prevent adverse effects like bradycardia or hypotension. Monitor the patient's electrolytes, especially potassium and sodium. Imbalances in electrolytes can cause arrhythmias and affect medication safety. Teach the patient about the purpose, dosage, and side effect of medications. This will help promote adherence and self-management when the patient starts to take the medications by themselves eventually. Instruct the patient to avoid stopping their medications abruptly. This will help prevent rebound hypertension or angina. Advise the patient to avoid grapefruit juice with statins or calcium channel blockers. The grapefruit juice alters the way these medications are metabolized in the body and increases their presence in the body for a longer time that it should be present. So it will increase the amount of calcium channel blockers in the body, which could be toxic, which could make the medication even more potent, which means hypotension, severe hypotension for the patient. And grapefruit juice also increases the amount of some statins in the body, which could also be toxic. So advise the patient to avoid grapefruit juice with statins or calcium channel blockers. Provide rest periods between activities to prevent fatigue and reduce myocardial oxygen demand, the amount of oxygen the heart needs. Assist the patient with activities of daily living, ADLs, as needed to help conserve the patient's energy and prevent overexertion. Monitor for signs of activity intolerance, such as shortness of breath, dyspnea, chest pain, dizziness, and excessive fatigue. This indicates that the cardiac output is inadequate for the patient's current activity level. At this point, you would provide rest and try not to exert the patient to this point of activity intolerance. Teach and reinforce a heart healthy diet that is a low sodium, low fat, low cholesterol, high fiber diet. This helps with blood pressure control, lipid levels, and weight. Teach the importance of medication compliance to help prevent relapse in the patient's disease condition or complications in the patient's disease condition. Educate the patient about recognizing early signs of heart failure so that they can seek medical timely medical intervention. Some early signs are weight gain, so they should be checking their weight daily. Swelling, such as swelling in their lower extremities, shortness of breath are a few early signs of heart failure. Teach the patient smoking cessation strategies, meaning teach them to stop smoking. Smoking causes vasoconstriction and reduces oxygen delivery. Teach regular follow ups for medication review and lab work. This helps promote early detection of complications or medication side effects. Common cardiac medications. So, cardiac medications work in different ways toward the same goal to help the heart do what it's supposed to do as effectively as possible. Some blood pressure medications will cause dilation of the vessels to reduce blood pressure. Some medications work to prevent blood clots from forming. Some medications help the heart beat a little more stronger if the heart is too weak and cannot beat strongly. Some medications help with contractility. Some medication will reduce the heart rate and reduce contractility so that the heart doesn't work too hard. Some medications will reduce preload, that is the amount of fluid going back to the heart. So, in a patient that's fluid overloaded, diuresing the patient, removing fluid from the patient's body will help the patient's heart to work better because it will not be working under stressful conditions. So, some medications that reduce preload are also helpful in managing cardiac disease. We're going to talk about some of this medication and what class they belong in. We're going to start with nitrates. Nitrates are medications that are used to relieve the chest pain from angina. One example is nitroglycerin, and they work by vasodilating the blood vessels. For patients taking this medication, we want to check their blood pressure. A headache is a common side effect of nitroglycerin. If they have a headache, it's good to space out the administration of the nitroglycerin so that they don't have these headaches too frequently. Anticoagulants are medications that work to prevent clot formation. Examples are heparin and warfarin. For patients taking this medication, it's important to monitor their INR and their PTT. It's important to institute bleeding precautions so that they don't bleed because when they're being anticoagulated, it is more difficult for their blood to clot. Therefore, if they have a big cut or a little cut, it might not stop bleeding because they are in a position where their blood does not clot easily due to the medication that they're taking. Cardiac glycosides such as digoxin increase contractility of the heart and reduce heart rate. For patients taking this medication, check the patient's pulse, hold the medication if the patient's pulse is less than 60, Monitor for toxicity because there is such a thing as digoxin toxicity. The patient may complain of nausea and yellow vision, visual disturbances. Statins are medications that reduce cholesterol production, so they work to reduce a person's risk of coronary artery disease because the plaque that forms on the walls of the vessels in coronary artery disease may be caused by cholesterol deposits on the blood vessels. An example of this medication is atorvastatin and simvastatin. Some of these medications is good to teach your patients to take at night if they're taking short acting statins. The liver makes cholesterol when we sleep. So if the patients will take the medication during the nighttime at bedtime, there's a good chance it can work better at that hour during those hours to prevent cholesterol production in the body. For patients taking this medication, we want to also monitor liver enzymes and ask the patient to avoid grape juice as it may increase toxicity of this medication. Diuretics such as furosemide and hydrochlorothiazide reduce fluid volume in the body and reduce preload by making the patient urinate. For patients taking this medication, it's important to monitor potassium, blood pressure, and urine output. This medication works to prevent overload and reduce edema. Beta blockers, example metoprolol and atenolol, they work to reduce heart rate and contractility. This reduces the oxygen demand of the heart. It reduces the amount of work that the heart has to do so that it's able to do its job as well as effectively as possible. For patients taking this medication, we want to check heart rate and blood pressure. We want to watch for bronchospasm. Some beta blockers work specifically on the heart, some others are not specific. So, beta blockers can act on the heart and on the lungs. When they act on the lungs, they cause the airways to constrict. So, especially for patients with asthma, um, bronchospasm is something to watch out for. ACE inhibitors such as lisinopril and enalapril work by causing vasodilation. This happens by reducing the amount of angiotensin 2 that the body produces. Angiotensin 2 is a potent vasoconstrictor that's usually produced in a situation where the heart is not perfusing the kidney as well as it should, or if the kidneys perceive that the heart is not perfusing them as well as they should, they cause this cascade to happen where angiotensin 2 gets produced. So that the goal of the angiotensin 2 is to increase perfusion from the heart to the kidneys. The problem is that if the heart is in heart failure and the kidneys start to produce this angiotensin 2, it gets more difficult for the heart to do its job. So, what ACE inhibitors do is reduce the amount of angiotensin 2 that's produced and therefore cause vasodilation um, to reduce blood pressure. For patients taking ACE inhibitors, we want to monitor blood pressure and potassium. One side effect of ACE inhibitors is a cough. Another side effect that could be fatal is angioedema, where the patient's mucous membranes are swelling. So you can have a situation where the patient's throat is swollen, where the patient's lips are swollen, and if the patient's throat gets swollen, it's a medical emergency because their airway might close and they might not be able to breathe. Calcium channel blockers, examples, diltiazem and amlodipine. They work to relax smooth muscles and therefore cause vasodilation and reduce blood pressure. For these patients, you want to monitor heart rate and blood pressure, avoid grapefruit juice as it inhibits drug metabolism and may increase toxicity. Angiotensin receptor blockers um, are somewhat similar to ACE inhibitors in that they cause vasodilation by preventing angiotensin 2 from doing what it's supposed to do. But the ARBs, the angiotensin receptor blockers, act in a different way. They prevent the angiotensin 2 from binding to its receptors. For patients taking this medication, we want to monitor potassium, blood pressure, and kidney function. We want to teach the patient to avoid potassium rich foods such as bananas and potassium sparing drugs. Thanks for watching. Please like, share, and subscribe. Visit me on Etsy at nosgozi.etsy.com or go to nosgozi.com for online quizzes and printable study materials.